Hello, everyone. This is Lady Linda Bird with the Secure Benefits Group. Come on in the room. I'm welcoming all my baby boomers because we need to be informed about the upcoming changes in with Medicare, the behind the scenes things, why it's so essential to understand Medicare and to be able to make the best educated choice. Listen, we are going into the open enrollment season. It's going to start October 15th and it will run until December 7th. During that time, you're going to be inundated with phone calls from scammers and some well-meaning people as well. But the bottom line is you want to be careful. You want to make sure that you have a safe place where you can go to get honest, transparent answers. So I am so excited because I have invited a very, very dear friend of mine. He's going to be here. We're going to do a Zoom. He's in Maryland. I'm in Florida. So we're going to kind of like come together. Isn't technology amazing? We're going to get together and we're going to have a discussion. And we're inviting you into our living rooms so that you can also be a part of that conversation. Well, my office, his office, I guess. But anyway, I'm kind of excited about it. And what we're going to be doing is on a weekly basis, we're going to be coming together and just tackling different topics. So if you're not a part of this community, please consider subscribing and then hitting that bell, the little bell that lets you know when we're going to be uploading a video. If we get to a point where I can do live come-ons, that would be great too. But if you have any questions, just drop them in the comment section. And we're going to put our contact information in the description box so that you'll be able to get in touch with us, with one of us, and get your questions answered. And I know there's a lot of places that you can go to get answers to different topics and things of that nature. But I do hope that you will turn to us because we're in it. We're about it. We're both senior citizens. I think, well, you'll see when you meet Greg, but I'll be 68 next month, and I've been on Medicare myself now. This will be my third year. So I have some experience. So hold on. I'm going to take a break, come back with Greg. Okay, well, you made it. Hello, Gregory. How you doing?
Hello.
Good. So this again, Lady Linda Bird with the Secure Benefits Group, and I have with me my dear friend, Mr. Greg McCoy, who is in Maryland. I'm in Florida. He's in Maryland. Thank God for technology. We're able to come together today on this platform to discuss Medicare, and it is so essential for seniors to understand the all the moving parts, and we want to keep it simple. We're going to dumb it down a little bit, but make it so that it's understandable, transparent, and honest. So now you guys kind of know a little bit about me. I'm going to pass it over to Mr. Greg. Greg, tell the people a little bit about you.
Number one, Linda, thank you for this opportunity to spend some time with you reviewing a very important topic for a lot of people here in America. My name is Greg McCoy. I'm going to tell everybody to remember the real McCoy. I am with the Real McCoy Group, LLC. And yes, I just run it into the ground. I have been involved in Medicare, Medicare Advantage, Medicare supplement plans since around 2005, 2006. And that amount of time has given me a chance to learn a lot about the overall program and understand its significance and the benefits it gives to seniors.
Wonderful.
And with today, I guess we're going to talk about Part A and Part B of Medicare.
Exactly. Now, we met about, I want to say maybe 15, have I known you that? For a while.
About 12 years ago.
About 12 years ago. You were with Aetna. Yeah. You were the Aetna regional manager, and I was just an agent up there in Baltimore. And Mr. McCoy has been very, very instrumental in teaching me a lot about this, not just the industry, but the first fundamental thing that I embraced and still to this day, it's what it is is we say do the right thing for the right reason. How I got into Medicare, my father, he's deceased now, but he knew I was an insurance agent, but I was just doing life at that time, and he would call me and say, ask me questions about Medicare, and I knew absolutely nothing. And so one time he said, well, this doesn't make any sense. You're an insurance agent. And you've got two elderly parents, and you're getting old yourself. You need to know. And at that point, I was like, he was right. So that's when I kind of pivoted in around 2010, and Medicare had become like my main focus. So I do consider myself pretty much of an expert, and a good resource. I'm also a baby boomer, and I'm also a Medicare beneficiary myself. So with that being out the way, let's get to it. Okay. So
Great.
why does everyone think that Medicare is so confusing?
That always amazes me. Doctors, lawyers, Indian chiefs, they've had insurance their whole life, but they get to Medicare and they become like deer in the headlights and they get frozen. Part of that is due to the fact that it's a program that addresses the needs of 65 million people. So there's no way to make it simple. And by that, I mean this. If 1% of the entire population of Medicare people has an exception, just 1% goes to the left, and you have to do something different about them. That's 650,000 people. That's just a lot of people.
It's a lot of people.
That's just a lot of people. And that's just 1%. And because you have to keep in mind that while we may be the same ages, we all have different experiences. We all have different levels of health. We all have different ways we approach our health. So Medicare has to be pretty flexible while at the same time providing a full level of care. So people are worried about it because it just seems so different. But what I tell them is it's just good health insurance. And no matter what anybody else says, it is good health insurance. And I can tell you, here's how the proof of the pudding.
Okay.
No one has heard this story. Mama and them went to the hospital and Medicare didn't approve the procedure and she died. Nobody's heard that story. No one. Medicare is a comprehensive health insurance program that covers the needs of seniors. Now, there are some costs to it, and that will kind of stick in some people's craw. And we'll talk about what those costs are as we go on. But if I could talk for a minute about Medicare, and please, Linda, interrupt me anytime you want.
No, go. You got it. You got the floor.
So Medicare came into being around 1966. President Johnson, part of the Great Society program. The intent was to make sure that people above the age of 65 had access to good health care. What we sometimes forget is that the life expectancy has grown by leaps and bounds in just the past 70 years. To give you an example, life expectancy, when they passed Social Security, when they gave Americans Social Security in the late 1930s, life expectancy was 64. So when they made the entry date into Social Security 65, they were thinking most people weren't going to be around to see it. And now life expectancy is around 78 for women and 75, 74 for men.
Wow.
So when you came to Medicare, they realized that they needed to provide health insurance for seniors that was affordable because the private market would charge too much for health insurance for a person that's 75 years old.
Okay.
So as a result, Medicare was passed by the Congress in 1966, and it had two parts to it at that time, Part A and Part B. Part A covers hospitalization. Everything that happens in a hospital is Part A. Part B is basically everything that happens outside of the hospital. And that would include things like doctor's visits, labs, blood work, x-rays, all of the fancy diagnostic tests they now give you. So you want to remember that when you get that Medicare card, that red, white, and blue card, and most of us will qualify for it at age 65.
So what are some of the exceptions to that rule?
Usually that will revolve around health.
Mm-hmm.
If somebody has an illness that Medicare deems serious enough, 2 years after that illness is identified, and the way they think of being identified is that a person goes on Social Security disability, they can qualify for Medicare at any age.
Okay, so it's for people that are 65 and older, or
yes,
under 65 with certain disabilities, which would include ALS or end-stage renal disease, which of course we know is dialysis. And we're going to touch on that in this series as well too. All right, so when I asked you about why people get all flustered and say they don't understand Medicare, let's break it down, Greg. There's how many parts to Medicare?
Right now, in terms of the conversation we're having, there's 4 parts.
Exactly.
Part A, Part B, Part D, and Part C. Now, of course, the government has to throw in a little wrinkle. So Part A covers hospitalization. Part B covers outpatient care.
Yeah,
doctor's
outside
visits,
of the hospital.
everything else outside of the hospital. Part D covers prescription drugs. And Part C is a combination of all 3.
Okay.
It's what they call a Medicare Advantage plan that covers hospitalization, A, doctors, B, and drugs, D.
You know, I always tell people the reason why they call it an Advantage plan is because it gives you other services that are not provided for within the original Medicare, such as some Medicare Advantage plans will give you eyeglasses. These are a pair of eyeglasses, as a matter of fact, that I got on my plan. Dental, some plans have dental, and all it varies from plan to plan. Then we have the supplements. Now, let's talk about the difference between a supplemental plan and what they provide as opposed to an Advantage plan.
So, think of this. Medicare, original Medicare. You apply, you get your red, white, and blue card. It covers hospital A, doctors B. A supplement plan is pretty much just like the word supplement. It supplements the payments, the co-payments, and the deductibles that original Medicare would have charged you with. To give you an example, there's a deductible on Part A of $1,664. That's the hospitalization. If you're hospitalized, your deductible is going to be $1,664. But Medicare picks up everything after that. If you, on the Part B, the deductible is $263. And then Medicare goes to an 80-20 split.
Okay.
So if you can imagine, you go to the doctor, you're billed $100. Medicare is going to pay $80 of that $100, 80%. and the other 20%, the $20, they're going to give to you. A supplement plan would fill those financial gaps. It would cover that deductible of $1,664 on the
Part A.
Part A, and now they leave you with the $263 on Part B.
They surely do.
But if you have a supplement plan, depending on the plan you get, the only outlay of your money you're going to make besides premiums is just $263. And frankly, that's if the medical provider gets around to charging you, because most of their money they get from Medicare.
Now, I think let's talk about pros and cons. So if we were doing like the Ben Franklin sheet, on this side with the supplements, typically any provider that accepts original Medicare will take the supplemental plan because they're actually billing original Medicare. The supplement is just taking care of your co-insurance or co-pays and things of that nature.
Exactly.
With the Medicare Advantage plan, you're going to either be in something that's called an HMO, and many people especially coming out of the workforce, understand what an HMO is, a health maintenance organization. So you have to go to doctors that are within that network of doctors. If you go outside of the network, then you will be responsible for those additional charges. Then there's also the PPO plan, which is a preferred provider organization. The caveat, though, is that even with the PPO, the doctor still has to accept it. They don't have to take it if they're not in the network. So I think sometimes, and then typically with an HMO, you have referrals. With the PPO, you do not have referrals. So I think it boils down to a matter of choice and economics. Can you afford that monthly premium that's attached to a supplement? Because typically Medicare Advantage plans are 0 to low premiums, depending on where you are. Like down here in Florida, most of our plans are an absolutely 0 premium. But I know up there in Maryland, where you're at, some of the Medicare Advantage plans carry premiums, right?
Oh, yeah.
Yeah.
They range from 0 to $50. They've got a couple of plans above $50, but I don't recommend those plans to anyone.
Mm-hmm.
Let's talk a little bit about the difference between the Medicare Advantage and the supplement plans. The Medicare Advantage plans are an agreement between a private insurance company and Medicare to provide health insurance for you. And the agreement goes somewhere along the lines that Medicare says, we're going to pay you a specific dollar amount per month for Linda. In exchange for that, you are going to do everything for her that we Medicare would do. So there's no drop off in coverage at all. There's no exclusions. Everything Medicare would do, the Medicare Advantage plan has to do. Now, this being America, in order to attract your interest, the Medicare plans offers you more benefits than original Medicare, because otherwise you wouldn't look at it. So original Medicare takes care of the doctors and the hospital, but it doesn't, for instance, take care of your teeth, dental, or your eyes, glasses, or sometimes your transportation. There's a host of ancillary benefits that the Medicare Advantage plans will offer you because they want your business.
Exactly. And
You're always. I'm sorry, go on.
I was going to say most Medicare Advantage plans have the prescription drug plan incorporated into them.
Yes.
Now there are some now that they have some that don't. That they're standalone, MA only plans. People need to understand, if you're in an MA only or a Medicare Advantage only plan, you cannot have a standalone drug plan unless you're in a PFFS, preferred fee for service plan. But with the Medicare supplement, so in addition to You have your Medicare supplement, which carries a premium. Then you have your drug plan, which has a premium. And then you have your Part B premium that the government is assessing, which is going up, by the way, everybody. It was 174 last year, and we found out that it's going up to I believe it was 185 for 2025. So I wish that our Social Security checks would go up to keep up with everything else, but at any rate. So that would be 3 premiums. And it's I think that's one of the things that does make the Medicare Advantage plan so attractive to the masses, is because you can get quality insurance. Now there are some setbacks, like every year. It's important. You don't have to change every year, but it's highly recommended that you, at least if your agent does not get in touch with you, then you need to find you an agent that can sit down and go over your plan for 2025, because they do change. This Medicare and You book, we put it over here on this side. I think I like that side better. I always used to get one when I was working. I would either get a client to let me have one of theirs or take my dad's, but now I get it delivered to me. This has got my name on it. So I've arrived. So, and the ANOC letters, those are very important too. You get that ANOC letter in the mail. That is your annual notice of change. That's the insurance company's legal responsibility and commitment to you, let you know what's going to happen with the plan that you are currently enrolled in moving forward into the next year. So you need to make sure that you don't, like some stuff is junk mail, but that is one piece of mail that is not junk mail. And you need to check into, I had one of my clients called me yesterday, and she's like, she got an ANOC letter where her plan is leaving the area. It's up in Maryland. So
if we take a moment and look behind the curtain at Medicare, we'll begin to see what their goals are.
Okay, let's talk
so on the Medicare Advantage plan, you're always under Medicare. So if you're always under Medicare, original Medicare, you might outsource your work to a private company like an Aetna, a Blue Cross Blue Shield, a Humana, any number of companies, but you're always under original Medicare. And original Medicare polices the insurance companies because they don't want them cutting corners around your health care. So towards that end, they will have a star rating system that will make it easy for you to understand who's good and who's not. And the star rating system goes from 1 to 5 stars. 5 stars mean they're cooking with gas. They're hitting on all cylinders, and they are providing great customer service, great medical outcomes.
I can't hear you. You lost. Greg.
You want to stay with those guys because
you muted yourself for a second.
Say it again.
I said you had muted yourself. I couldn't hear you.
Oh, okay. You guys can hear me now?
Yeah, we can hear you now.
Great. So there's that policing that Medicare does, and they do a relatively good job of monitoring the insurance companies. Now, every year, some of the things they put into effect are every year you get a chance during what they call annual open enrollment to change Medicare Advantage plans. Now, people will look at that and think, oh, that's a hassle because now they're going to bombard you on television, on the radio. They're going to send you mail every other day. And all those things are true. That's all true. But here's what it does. The insurance companies, which are businesses, know that you have the ability to vote with your feet. So they have to sharpen their pencil every year.
I never looked at it that way. That's an excellent way of looking at that.
Because
they want to keep the business.
They want to keep your business because it's competitive. So let's say, just using examples, let's say Humana has, as an enticement for your business, they're telling you you can go see your primary doctor, zero copay. So you see Dr. Smith, it doesn't cost you a dime. You can go see your specialist for a $20 copay. And you think, okay, if I have to go see my cardiologist, it costs me $20, I can do that. Next year, Humana says, well, you know what? We're going to charge you $15 copay for a primary, and we're going to raise your specialist up to $40. Well, you're thinking to yourself, well, what's that about? What do you mean you're raising my price? Well, when Humana is doing their computation, they've got to remember, well, what if Aetna keeps their prices low? What if United Healthcare drops their prices? What if we're the only ones out there with a $40 copay for a specialist? Our people will leave. So you know what? We're going to sharpen our pencils a little bit more because this is a competitive environment. That was a smart thing that Medicare did. It's a bit of a pain because every year you're getting bombarded. But remember this, if you love your plan, you don't have to do a thing. Another thing that Medicare has done is, as Linda just mentioned, that ANOC letter, annual notice of change letter. Medicare has ruled that all of the insurance companies have to have the same format of this letter because the annual notice of change letter will tell you differences in your plan from one year to the next. So if you have a plan that has a zero copay on primary care in 2024, and that plan decides that, you know, we're going to raise our copay to $10, they have to tell you in a clear, concise format that matches every other company exactly what they're doing. If they drop some prices and gave you a benefit, if they raise some prices and they're going to cost you some more money. So that's another thing that Medicare has done to kind of give you a fighting chance. You're going to get a letter. If you have a Medicare Advantage plan, you will get a letter in the first week of October. That's when they all come out. Mm-hmm. They all try to hit around the first, but sometime in the first week of October.
Well, Greg, I think we've covered a lot of material here today. And
there's a lot to talk about. I'm glad we had a chance to go.
There is a lot. So we want to thank you for coming into our living room. This is where we live. This is my office. But we're going to how about we reconvene again next week and let's dig a little deep, let's delve a little deeper into something that's going to be very, very important for people to know about, and that is this Inflation Reduction Act that's going to be affecting the prescription drug plans across the board. That's changing. You know, we had
very important.
Very, very important. So if you've listen, audience, if you stayed with us this far, we want to thank you and ask that you subscribe, become a subscriber to this channel, Lady Linda Bird, and hit that little bell, click on that bell with the notification so you'll know when we upload. And we will be back. I'm going to put our contact information in the description box so that anyone that catches this on a replay, interested in getting in touch with either one of us. And I'll also put the states that we are currently licensed in. So thank you for your time. Thank you for your time, Mr. Greg. It was good seeing you.
It was good to see you, and thank you for the time and a chance to talk to people about something meaningful in their lives.
Exactly. So, all right. Take care. We're going to sign off. We'll see you next week.